everyone, I am Nirmala and this is your podcast, One Life, One Story. And today I'm going to cover a very important topic, and that is COVID-19 among small babies and children. Please do watch this till the end. In the first wave of COVID-19, at least the parents of small children and babies were relieved that the virus was not effective on small children and babies. But this time the story is different. This time we are seeing many cases of small children getting affected by the virus. I should cover this story so that our viewers, especially the parents of small babies and children, would get the takeaways and learn the precautionary measures so that the babies and children are safe from this virus. I have been reading a lot about what the doctors, especially the pediatricians and the COVID warriors, are saying about this virus so that I can get the takeaways and share the learnings with all of you. So the first thing that we all would like to know is, what are the symptoms of COVID-19 among babies and children? Yes, there are prominent symptoms which are visible, you can say slightly visible in some cases, more prominently visible in some other cases. And those symptoms are cold, cough, fever, chills, headache, joint pain, vomiting, and even rashes on the body. These are some of the symptoms. So if you see any of these symptoms in your children, please do not get panic or do not hesitate to get the COVID test done for your child. It is always better to detect and get the treatment done as early as possible. The second thing is, or the second questions that parents ask is, what if my child is COVID positive? What do I do? So here I would like to tell that there is no need to worry again, no need to get panic. First and foremost, you should consult your child's pediatrician. They will give you the right treatment. And I would also like to add that 80% of the time the babies have mild symptoms. There is no need for them to be hospitalized. Treatment can be done at home, at the comfort of the home. It's only 10 to 20% cases where the child needs to be hospitalized, and that also normally happens when the COVID test is done late, or the detection of the virus is done late, because the parents were scared, or they're worried if the child becomes positive, what do we do, and those kind of questions. So my request again would be, if there is any kind of symptoms you are seeing in your child, please get the COVID test done for your child and for yourself too, for the entire family actually. Now we know about the symptoms and the treatment, but the most important thing is prevention. As we all know, as we all say, prevention is better than cure. So it is our most important duty to prevent our children from getting infected by this virus. Again, here with this virus COVID-19, as we all know, everyone, right from small children to adults and senior citizens, we all know about the preventionary measures for this virus. But still, I would like to highlight again in this show the precautionary or the preventionary steps our children and babies, small babies, should take. First, as we all know, mask. We should make sure that when our children are stepping out of the house, they wear mask and step out. They wear mask all the time when they're outside. Second is, we have to stop children from gathering together. I know it is very difficult. I know it is very sad that our children, they love to play around, play with their friends and all. But at this situation, at this moment, we cannot allow them to play with each other until and unless they're from the same family, from the same house, they stay in the same house, they are siblings. That's a different story. Otherwise, if they stay in different houses, they stay in different societies, we are very sorry, but they cannot mingle together. They cannot be playing around together at this moment. We cannot risk that. We cannot take that risk at all. Third thing, which we all know, is about sanitizing your hands. It's about washing your hands frequently, very, very frequently, so that virus doesn't affect us or doesn't come into us in any form through our hands. This is also something we all know. We all know it very well. And the next thing is, again, something which we all know, is about boosting our immunity. Be it children, be it adults, be it senior citizens. It's about boosting your immunity. If your immune power is higher, then there are lesser chances that the virus would attack us. The most important thing is, our children should have a good balanced diet that has proteins, vitamins, and all other important elements, and lots of liquid in the form of water, juices, anything. But lots of liquid is also required, is also very important for them. Lastly, I would like to add that we adults are the role models for our children. So as parents, we all need to be responsible. We all need to follow the norms, the rules that need to be followed, so that the spread of this virus gets curbed down. If we follow the rules, if we follow the norms, our children will copy us and will do the same. Thank you so much for watching this video. I hope and pray that every one of us, each one of us, and our children are safe and healthy and away from this virus. If you like this video, please do like, subscribe, and share with your friends and families. Thank you once again.